More than 22 million people in the U.S. have asthma and asthma symptoms, which include coughing, wheezing, and shortness of breath, and it can have a negative impact on the patient's ability to perform daily activities. Even patients currently treated with a daily medicine to control their asthma continue to experience symptoms. Now, a new survey from the Allergy and Asthma Network has taken a closer look at the asthma patients who continue to experience symptoms, and it sheds some light on attitudes from patients and healthcare providers. Joining me today is Dr. Purvi Parikh, Allergist and Immunologist at NYU Medical Center, and Tonya Linders, President and Chief Executive Officer of Allergy and Asthma Network. Thank you for joining me today.
Thank you for having us.
Thank you.
Now, first, doctor, what are the common symptoms of asthma?
So common symptoms are coughing, wheezing, shortness of breath, chest tightness. Those are all common things that someone with asthma might experience.
And what does it mean for a patient if their asthma is uncontrolled?
So someone who's uncontrolled is someone who's waking up at night with those symptoms, someone who's having these symptoms even more than 1 or 2 days a week. Even if you have to visit your doctor or the emergency room once or twice in a whole given year, that's considered uncontrolled. Or if you're missing a considerable amount of days of work or school, you're not well controlled.
Now, how can healthcare professionals improve the dialogue with their patients?
So it's really assessing who is having these problems and who isn't. Often, when patients come in for their routine visits, patients will think they'll say, oh, I feel great, but then when we ask more detailed, pointed questions, it turns out that they are having a lot of these symptoms on a daily basis, on a nightly basis, or missing school. So it's important that the healthcare providers ask the right questions.
Absolutely. Now, Tonya, how do asthma symptoms affect the daily lives of patients?
Well, in our open asthma survey, what we found is that the majority of patients actually think that they're well controlled. So if you just ask them, is your asthma controlled? They say yes. But then when you dig a little deeper and ask more specific questions around activities of daily living, what we found is that greater than 70% of them were actually having symptoms at least one time a week. So there's this disconnect between what patients perceive and what's actually reality. And then secondly, with healthcare professionals thought that about 84% of their patients were well controlled. And yet again, when objectively assessed, that wasn't necessarily the case.
Now, how do you feel that healthcare professionals and patients can work together to bridge those gaps that you mentioned and address the unmet needs of patients with asthma?
Well, in the open asthma survey, one of the things that we found is that it is a two-way street. It's a two-way communication that begins certainly with an informed, educated, empowered patient who's coming to the visit prepared, willing to admit what's going on and be honest and candid with their healthcare provider. And then secondly, it's a healthcare professional who's asking the right questions, who's not just saying, how's your asthma? Who is actually asking about sleep disturbances, how many days they're missing work or school, how many times they're using their quick relief or rescue medication. These deeper questions actually lead to a more effective dialogue and optimally to better health outcomes.
Absolutely. And lastly, Dr. and Tonya, where can people go to get more information on how to work together with their healthcare professional?
So the website openasthma.com is a great resource that kind of gives the results of the survey, as well as has links to the Allergy and Asthma Network website and other great resources for both patients and physicians.
Great, thank you so much. And for more information on how to talk to your healthcare provider as well as additional resources, visit www.openasthma.com. Thank you so much. It's been a pleasure.
Thank you.
Thank you.
Have a wonderful day.
You too.